Looking at this chest radiograph, the first thing that catches my attention is the increased translucency in the left hemithorax. Now, this could easily be attributed to patient rotation towards the left side. And that's something to always keep in mind when interpreting films. Technical factors like positioning can greatly influence the findings. The right heart border looks a bit indistinct here. Initially, that makes me wonder if there could be some underlying pathology in the right middle lobe, perhaps a consolidation or atelectasis. But before jumping to conclusions, it's essential to take a step back and consider the overall appearance. The lungs look pretty clear, without any obvious signs of focal consolidation or effusion, so that makes an active lung disease less likely. What's particularly notable, though, is the structure of the thoracic cage itself. The posterior ribs are unusually horizontal, with sharp inferior angulation anteriorly, which immediately raises suspicion for a structural abnormality. This pattern is highly suggestive of pectus excavatum, a chest wall deformity that often displaces the heart and compresses the lungs. This could explain the displacement of the heart towards the left, which we see on this film. The right lower zone opacification may well be related to this rib deformity rather than a true consolidation, especially in the absence of clinical symptoms like fever or productive cough that would hint at infection. So in terms of differentials, while we can't completely exclude possibilities like right middle lobe consolidation, atelectasis, or even pleural thickening, the rib deformity and the displacement of structures really point us towards pectus excavatum as the most likely explanation. To further clarify, I'd request a lateral chest radiograph. That would help confirm whether the antero-posterior diameter of the chest is reduced, which is classic for pectus excavatum. Additionally, I'd inquire about any clinical symptoms like dyspnea or chest pain, which could indicate cardiorespiratory compromise. If the patient is symptomatic, I'd go ahead with an echocardiogram or pulmonary function testing to assess the functional impact of this deformity. Now, a question that could come up here is how to distinguish pectus excavatum from a middle lobe consolidation. And the key here is really in the morphology of the ribs. Horizontal posterior ribs with sharp inferior angulation are hallmarks of pectus excavatum, whereas consolidation would present with parenchymal changes like air bronchograms or a more homogeneous opacification in the affected area, neither of which is present here. The examiners might also ask, what other investigations would you order? In this case, the next step is clear. A lateral chest radiograph would help confirm the diagnosis, and possibly a CT chest for a more detailed assessment if needed. If there's suspicion of cardiorespiratory impact, I'd opt for echocardiography and pulmonary function tests. Lastly, a potential follow-up question could be, what are the clinical implications of pectus excavatum? While this condition is often asymptomatic, severe cases can lead to cardiopulmonary compromise, where the compressed lungs and displaced heart might result in dyspnea, reduced exercise tolerance, or even arrhythmias. In conclusion, it looks like this patient is presenting with features highly suggestive of pectus excavatum, a structural thoracic deformity. If you found this breakdown helpful and want more insights like this, don't forget to subscribe to Radiology Made Easy. We'll keep exploring interesting cases, and if you have any questions or cases of your own, feel free to drop a comment below. Let's keep learning together.